Close your eyes and make a couple of sighs. Relax your shoulders downward. And let go of anything that doesn't suit you anymore, or you just don't want to deal with it anymore, or just saying silently to yourself, I let go. Even make a sigh again. Even pursing your lips as you exhale. And then even exploring the sensations as you inhale. Place the tip of your tongue to your palate. And then as you exhale, purse your lips and just release your tongue from the palate. A couple more breaths. As that is a fast way to release your sympathetic and parasympathetic nervous system. And then allow your tongue to come in a resting position inside your mouth. And then bring your awareness toward the flow of your breath and kind of noticing where you feel your breath. Do you feel it coming into your nose? Do you feel it more in your throat, or your upper chest, the lower rib cage, or your abdomen? Where do you feel your breath? And then once you recognize where you feel your breath, can you lengthen your spine a little bit, perhaps adjust your spine or move a little bit slightly from right to left side with your torso, just micro movement, not even really moving it, just micro movement. And then again, listening or observing your breath and noticing if something changed. And then simply just enjoying your breath as you inhale and exhale. Listening to the sound of your breath. And then change your perception and listen to the sound outside of your practice area. And then as you are listening to the outside, add any additional sound that could happen and could cause a distraction. That even includes somebody knocking on the door, phone ringing, anything like that. Then bring your awareness to the sound inside your practice room. Then add any additional sound that could happen. Then bring your awareness back again to the flow of your breath. And perhaps now count your breath, just as it flows, just the inhalation. Just count the inhalation and then count the exhalation. So both inhalation and exhalation are in the same rhythm. Let's say the count would be a 4. So count in the speed as your breath is. So allow the count to be 4, inhaling. Hold now your breath to the count of 4, and then exhale out to the count of 6. So let's begin by breathing in to count of 4, 3, 2, 1. Hold it. 4, 3, 2, 4. Exhale. 6, 5, 4, 3, 2, 6. Inhale. 4, 3, 2, 4. Holding. 4, 3, 2, 4. Exhaling. 6, 5, 4, 3, 2, 6. Inhaling. 4, 3, 2, 4. Holding. 4, 5, 3, 2, 4. Exhaling. 6, 5, 4, 3, 2, 6. And then just come into a normal breath. Or take an extra breath in and out. Now set your intent for today. Anything you like to witness or experience throughout your practice. Allow your mind and your curiosity to be open and receptive to anything what may come up within your body or within your emotions or your thought. Just welcome all sensation that occurs. Now let's rub the palm of your hands and place them over your eyes. I'm going to do that 3 times. And by the 3rd time, I invite you to open your eyes and then use your fingertip and just massage a little bit the forehead, just to bring in movement into your fascia system. And then from the forehead, take your finger pads and just rub on the side of the temple a little bit. And then from the side of the temple, move it down toward the jaw. And then even open and close the jaw as you make the movement with your fingers, with the pad of your fingers. And then even move your jaw from side to side. And then keep your jaw open for a little bit as you make the rotation with your fingertips. Just feel the tightness. It's not really tight. That muscle of the jaw is tighter. It's a firmer type of muscle. So we have the strength to open and close the jaw. Take your index finger and just, if you soften your jaw again, and just go to the lower part of the jaw itself. You can feel that muscle as you close it. You can feel that muscle to be a little bit more pliable. Just bring in a little bit more circulation and movement within that tissue. Good, and then relax. And then take your index finger and your middle finger and just go in front and behind your ear, just moving it up and down. There's a lot of lymph nodes that resides within this area, just helping. Even the station tubes that's linked to your sinus and to the back of your throat. Just kind of massage that a little bit. Just integrating your whole soma, your whole being, fascia system or your body. It's not just one movement or one part of it. So then from here, take your finger and then flatten your hand and just go right underneath your earlobe. Those are the major glands and lymph nodes that resides just below your ear. We just want to bring in movement a little bit into that section right there, into your section. So your body system can, throughout your movement, can release and let go some of the stagnation and to improve your immune system. And then from there, take your hands and place them right by your on below your sternum, and then just massage. You can go use just one hand and go across your heart from one side to the next side. Those are unseen pathways for your lymph system or lymphic system. You just kind of go right side, left side with your hand. Just help your fascia system or your lymph system to release a little bit, especially in the winter season when when your body likes to hibernate and not really do much movement. Okay, so then relax, place your hands onto your knees, and then really slowly round your spine, pulling your navel in toward your spine, and then open the heart and arch. Just slightly bring your head to the back, so the movement is more in your thoracic area. We just move a little bit, arching and rounding. And then as you make this movement, noticing the reaction of your thighs and your hips, that they also move, that your pubic bone contracts forward, your tailbone moves a little bit forward and to the back. Just kind of noticing the movement. And then stop with the movement. Now bend your left knee and place your left foot to the back of your left sitting bone and allow your right foot to be in the front. So the lower leg of your right leg is in the front. Your right foot is coming up to your left knee. If you need to, you can see, I need a little bit more support on my right sitting bone, so I invite you to put something underneath your right sitting bone if you need to. Take a moment and sit with your spine elongate. Just noticing your thighs, noticing your knee and your calf, the side of the body, the hip area, just noticing how you sit in this position comfortably. Then take your right hand and place it onto the floor. And if you have a block, you can place your hand onto the block. The idea is that your spine stays elongate as you do not have to go all the way to the side. Place your left hand onto the right shoulder. And then as you exhale, go into a rotation to the right side and then come forward. And allow the rotation to be within your thoracic area. And then even going more deeper into the rotation. So as you go to the right side, look even to the left side and allow your head to move along into the movement. Noticing as you make this movement how your pelvis is shifting and the movement from the shoulder and the rotation of the head even extends down toward your left hip. Allow to now explore that the movement comes from your soma, that means from your navel area. So direct it more from your navel area so you have less movement within the pelvis or balanced movement. Noticing that the fascia system, so if you turn your head, turn the shoulder, your abdominal also moves, and your hip and the knee and your calves and So you can feel that movement traveling. And then stop with the movement. So you're in a neutral position. And now you're going to go opposite with your head movement. So if when your shoulder comes to the right side, you first have your head to the right. Now turn your head to the left shoulder. As you come and bring your left shoulder to the left side, your head goes to the right. As you move your right shoulder to the right side, your head comes to the left. So explore with the movement. And noticing as you make this movement, your eyes look, if you look to the right side, your shoulders on the left, your eyes are also on the right. When you move your shoulder to the right, your head is to the left shoulder and looking over the left shoulder. So allow the eyes to go along with it. And go really slow so you can, your motor skills, your sensory motor can noticing the differences in the movement. You're gaining more range of motion within your body system going slower. Now stop in a neutral position. Now allow your eyes to go the opposite direction from your head. So you have three things going on. So let's begin. Let's bring your right shoulder to the right side. Your head goes to the left and your eyes go to the right. Now your head, your shoulder goes to the left. Your head goes to the right. Your eyes go to the left. Explore. And then stop with that movement. Come back into a neutral position. So allow the hands just to barely touch the floor on your right hand. You can relax your left hand, so you're just sitting with your spine elongate, pull it forward. Take an extra breath in and out. And now bring your chin downward and your eyes go down. Bring your head up and your eyes come up. Let's do that 2 more times. So now bring your head back into a neutral position. Now we're going to change the positioning with your eyes. If you bring your head down, your eyes come up. As you bring your head up, your eyes go down. Head comes down, your eyes come up. Head comes up, your eyes go down. So those are skills that help you. You do that actually unconsciously a lot of times in the car. You keep your head forward. And a lot of times you see in your peripheral vision, the right mirror and the left mirror, just not moving your head, but rather moving just your eyes. And you can see that. So now this teaches your brain that you can look down with your head being, you can look up without moving the head. And then stop with the movement. Take a breath in and out. And now let's reverse the positioning. Allow your left lower leg to be forward, the right knee bent, and your right foot coming toward your right sitting bone. If you need to, you can put a blanket underneath your hip. Sitting in this position first, take a note or just notice in sitting in this position. So you want to sit comfortably. You can relax your lower back. You can relax your hip and just noticing any tension that you feel in your quads, your knees, calves, shin, the right and the left side. You can lengthen your spine and noticing if that would make a difference within your pelvis, and then soften your spine and noticing as you lengthen your spine how your pelvis likes to anterior rotate maybe forward, and then as you soften how your tailbone actually starting to release a little bit, and it kind of balances out. Just kind of take a note what your pelvis is doing. Everybody pelvis is different. So you kind of go into a gentle rocking. So I call it anterior posterior tilt, where they're just minor movement by even just some, like I said, it just is maybe enough for your body. Just lengthen your spine and then soften your spine. It might be just enough. And if you place your hand by your knees, and when you do the rocking with your pelvis, you may noticing slight movements on your right thigh, because one of your quad muscle is attaches to the iliac, to the hip. And when you post anterior tilt your hip, you can actually feel that underneath your fingertips. One is attached by the iliac and then by the just below, above the patella. Okay, then relax, or rectus femoris, I think is a bone. All right, let's get into a movement. Let's place your left hand onto the floor or onto a block for support. Take your right hand onto your shoulder. And now go into the rotation to the right side. And just do a half rotation. Half rotation would be in the midline. Your torso is pointed in line with your lower leg. And then as you exhale, you turn. Doesn't have to be turning that much, but just turning. And then noticing how far your torso turns too. Where is your end? Where do you stop with the turning? And then noticing the senses in your hip area on the right side and then the left side. And then consciously start turning and going into rotation from your navel. So these are movements that we need, you're needing on a daily basis, where you use your abdominal muscles to reach over your shoulder, turning, getting up in a chair, turning. So these are all unconscious movements, but it brings in movement and fluidity. Now let's begin to, let's stop here for a moment in a neutral position. And now let's begin to do the movement with your head. So as you bring your left shoulder to the left side, your head is on the left. Now turn your head to the right side. As you bring your shoulder to the right, your head goes to the left. As you bring your shoulder to the left, your head goes to the right. So go ahead and do the movement. These muscles, or that fascia system, is kind of like a squeezing of muscles, or a wringing, I would say a wringing out. It's a movement that involves a lot of muscles in your neck and shoulder, releases tension within your neck, then the shoulder, works with your mental as far as bringing in neurons. Okay. Allow your eyes to go with your head. Then allow the movement to become soft, gentle. And then instead of having all your weight on the palm of your left hand or on your hand, engage a little bit the core muscle. So you don't put all your weight onto the hand. So as you make the movement, you hold your torso a little bit. So you're engaging the core muscle as you make the movement. That's it. Noticing how that changes when you put less weight on your hand. And then come to a stop. Now, you're going to add the movement of your eyes. So let's begin by movement with your head. Your shoulder goes to the right, your head goes to the left, and your eyes go to the left. As you bring your shoulder to the right side, your head goes to the left, and your eyes go to the right. Excellent. Couple more times. Good, and then we stop with that movement. Release your hands and place your hands again onto your knee. And now you're gonna move your head. So first, allow your head to chin down toward your sternum, and then lift your head up. Allow first your eyes go with the movement. Now, allow your eyes to go the opposite direction. If your head comes down, your eyes come up. When your head comes up, your eyes go down. That's it. Allow the head to tilt in a comfortable way to the back, so not an extreme way, like within your comfort zone. Good, and then stop with that movement. Now, from here, let's come onto all four. And then on all fours, allow yourself just to go into any kind of stretching that your body desires or you desire. Any kind of stretching that feels right for you. And then stop with that movement. Situate yourself on all fours. Put a little bit more weight onto your hands. You can bring your pelvis even forward, holding it in this position. Then shift your hips or your weight all the way down toward your heel. So you're bringing your butt down toward your heel. Then come back into a neutral position. Turn your toes under and lift yourself up toward the sky. Then work with your heels up and down, stretching the back of your leg and bringing in movement within your hip area, right side and left side. And then stop with the movement. Then bring your head closer toward your feet so you feel like an opening within your shoulder. And then walk with your feet toward your hands. Place your chest onto your thighs. And then move from your knees to your ankle. So just moving. This is bringing in movement into the back of your leg. And as you make this movement, noticing how your feet is responding, your ankles responding. And then stop with the movement. Bend your knees some more. Bring your arms next to your ears. Go into a chair pose. And then stand into a standing position and then back bending. Then bringing your hands in front of the heart. Into Anjali Mudra, connecting the body, mind, and breath. Bringing your arms next to your body. Releasing and letting go. Standing in Tadasana. Sensing and feeling the strength of the visualization of mountain pose. Now let's practice the triangle. Step back with your right leg into a wide stance. Bring your arms out to the side. And the triangle is practiced with your legs far enough apart so you feel comfortable. So we're working with your hip area now by tilting your hip toward the left side, right side, and your arm goes to the left, and then allow your left arm to dangle down while you bend your right elbow. Bring your right shoulder toward the sky. And you can look up toward the sky. And then you're going to go into an isometric movement or movement where you move from your hip. And you're just going to move and bop basically with your spine elongate up and down. It really requires a lot of muscles in your hip area. Also works with your tension fascia lata, the inside part of your leg. A lot of muscles within your upper quads. And the movement is like exactly just like that, perfect. Shoulders are I'm exaggerating it a little bit so you can see it clearer on the video or the broadcast, but it can be just a micro movement. Biggest part of it as well is not just the movement of your hip, your work with your obliques. The obliques are the powerhouse to keep your body and your tummy firm and all the organs in place. Slowly come up again with your torso now. Turn your left foot forward. And let's just bring your legs toward each other for a moment. Stand in Tadasana, mountain pose again. Visualize this great mountain with a snow peak on it, and visualize that as you inhale that vitality, the beauty, the strength, whatever you can think of, what else you can think of what does a mountain represent to you? And as you relax, or as you visualize that, relax your knees, relax the shoulder, relax your body as good as you can in a standing position, and noticing if you overarch your lower back, or can you relax your hip a little bit and your body a little bit more. What happens if you tug in your tailbone or tighten your buttock muscles? Can you relax the muscles again? Tighten it back up, the buttock muscles, relaxing again. And then just stand without the least muscle amount engaged that you can. That allows your fascia system to go back into, or resetting and going into a system where you feel more balanced. Now, let's start with the visualization. Widen your stance. And now turn your left foot 90 degrees. Bring your arms up to the side. So now we're going to practice a triangle on the right side. Tilt toward the right with your right arm. Bend your left arm behind your back. Allow the right arm just to dangle down. Shoulder comes up toward the sky. So if your intuition tells you just want to hold it in that position, I invite you to do so. Otherwise, again, bob up and down from your hip. That means your action is, you can, if you put your hand right on top of your upper thigh and you move your torso up and down, you can feel that within that region of your thigh a little bit. Spine stays elongated. So then you can relax once you feel comfortable with this movement. You can feel a lengthening on the inside of your leg, the sartorius muscle. You can maybe feel now that maybe it shifts now to your obliques, to your quadratum lumborum, to the back of your muscle. So everybody has a little bit different sensation. Maybe you feel it more in your heels or calves or shin. Just noticing, are you able to keep your spine in such a way, like imaginary wall behind your back? And the more you lengthen your spine, how does that affect your sensation on the inside of your right leg? And how's the weight, your weight distribution from your right foot toward the left foot? So that means a lot of times when you do the bobbing, a lot of times you have more weight on your right heel because you are leaning a little bit to the right. But when you get your core again a little bit engaged, maybe you can shift the weight so you feel that both feet are equally on the floor. And maybe you can feel your muscles a lot more deep on the inside of your left side engaged than the right side, and that's all okay. Then slowly raise your torso up. Bring your right foot forward. Let's bring your legs toward each other and stand in Tadasana again, mountain pose. So in this moment, you're just gonna let your body go back, your fascia system, your muscles, go back into its place where it feels most comfortable, most relaxed. Just taking a breath in and out. You can again visualize this mountain picture and allow, actually, if you visualize a mountain with a snow peak top and visualize like a huge waterfall coming down, or not a huge, but any waterfall coming down. Imagine that this waterfall represents fluidity and movement within your nervous, within your tendons, bringing in movement and nourishment toward your tendons, toward your muscles. All right. So now we end with the visualization. If you can, come to the front of the mat. We're going to prepare now to go onto the floor. So before you do so, open your arms wide and bring your arms backward. So you feel like stretching of the fascia system in the front of your arms. Feel your shoulder blades coming together, but not overarching your lower back. It would be the same sensation if you could imagine I would be leaning into a door frame. And you lean a little bit forward in your arms, with your arms straight, elbows straight, come to the back. So you can feel like the stretching in your delta, in your pectoralis, the front of the shoulder. Perhaps you can feel it behind your shoulder blade. Then relax, shake it out. Now swing your arms upward toward the sky, reaching upward, and then come into a forward fold. Place your hands next to your feet. Step back with your right leg. Come into a lunge by bringing your hip downward, looking up. And yes, your eyes are up and your head is up. Now, just bring your eyes downward and upward. And just noticing, not moving the head, but just your eyes up and down. And then stop with your eye movement. Lift your hip up and step forward with your right leg. Now step back with your left leg. Bring your hip downward so you're going into a lunge again. Looking up, your eyes are up towards the sky. Now look down with your eyes and look up with your eyes. Good, and then bring your eyes in a neutral position. Hands flat, step back with your right and go into a blank position. Holding it here, breathing in and out. Holding it a little bit longer. And then come onto your knee. Elbows are soft, the soft spot of your elbows is forward. Bend your elbow and go into chaturanga. Then straighten your spine. Hands are next to your chest, heart opens, feet flat. Holding and breathing. Elbows are next to your midline. And then push yourself into upward dog. Bring your shoulders away from your ears. Perfect. And then come onto all fours. And then from all fours, move your knees to the right side. And then from the right side, straighten your legs. So you're in a seated position now. So now, if you have that roller handy or that towel, I forgot now, you got a towel or a roller? Towel, it looks like. Okay. So we'll take that towel now, or that roller. I'm going to use a roller. And we'll place that on your lower back. Let's start to do this on your lower butt, lower back. So when you come back and you roll, you also can use at this point a block if you want, but you place it right by your sacrum, the bony part of it. So if you have a towel, if you have a little bit of pressure, it's okay. And then if you move your knee a little bit from the right side to left side, you put a little bit of pressure on your bony part of your sacrum. Right side, left side. Good. And now if you go in a circle with both knees, and then you increase the circle. So then when you go in a bigger circle, you can put pressure on the outer edge of the sacrum, right side, left side. As you can see, exploring, even bringing your knee way over to the left side, then way over to the right side. And then stop. Place your feet flat onto the floor. And now you are moving that towel a little bit higher up. Actually, you're going to go further so the towel or the roller is right around your bra line or just below the scapula, right where the bra is. So now in this position, if you have a roller, you can go very slowly up and down with the roller. If you have a towel, just allow yourself to sit in this position and just feel your the towel resting just below the scapula. Then bring that roller a little bit more in by your shoulder. Yeah, it kind of depends on your body. If you let your chest soften, can you bring your head downward toward the floor and your arms out to the side comfortably? And with a roller, you can adjust it to your comfort zone. It might be easier for you to have it further down on your below the rib, the bra line, around the bra line, or higher by your shoulder, where, I don't know, each person is a little bit different. Find that place where you can rest your head onto the floor comfortably. And you feel like an opening right here just below the xiphoid process. The xiphoid process is right there where your ribs fan out from the right side to the left side. And you may just wanna, if that doesn't feel good, you can scoot up and just rest with the towel on your sacrum. So you follow a little bit more your intuition, what feels right for you. And then just take a moment and breathe in and out. When you allow that to be right by your xiphoid process, you can feel the lengthening of your abdominals. So soften into that area. Allow your feet to rest, and then noticing too how you rest your knees. Is your knees coming toward each other? Are you able to keep your knees a little bit further apart? Do you feel like you need to change the positioning of the roller? And that's okay. As you notice, I switch around quite a bit, and it seems like can't find comfortability. That's okay. So then, if you can't find comfortability, I invite you to move that roller out to the side and then explore with a block and place the block underneath your sacrum. Or if you feel comfortable, continue having the roller on your bra line. Take a moment and just breathe in and out. Soften your body into the roller or into the opening. So you feel like this opening of your stomach, the upper part of the stomach, and then your part of the stomach goes into the first small intestine. There's only one intestine. And then if you want more release, you can take your fingertips and perhaps just move from the ribs down towards your belly button. Just kind of push it down a little bit. If you feel like any tightness is in there, or your intuition tells you to move that, so go ahead and move that. Also in this area, just below the ribs, your vagus nerve resides. If you feel a knot in there or a hard movement, use your fingertips and go in a circle. And then from the circle, take it from the middle part of your belly down toward your belly button, or to the right and left side, more or less to the left. Because that's the movement of the small intestine. That's the movement going to the descending colon. So using your fingertips to do gentle massage around your small intestine, large intestine. It just helps your body system to release the tension in your abdominals, number one. Number two, helping any stagnation within your soma, within your belly. And then stop with the massaging of your abdomen. Slowly now lift your pelvis off the floor and remove the block from underneath. Place your hip down onto the floor. Reach now for your left knee and just move your left knee more toward the sternum or toward the midline. So you get a gentle, just a little bit of a stretch in your lower back perhaps, or in your hip area. Take a breath in and out. Take a breath so you can feel your ribs expanding and contracting. Then release the pressure with your hand. And then use your left hand to reach for your outer left toe if you can. Otherwise, reach for your lower leg and move your knee out to the past your armpit out on the left side. Try to keep your pelvis even yet. So not that your left pelvis comes up and you have this space right here. So try to keep your pelvis onto the floor as you move your knee over. And then when you breathe, deeply breathe in and out. You can feel your belly expanding. And a lot of times it releases the hip flexors and the deep psoas muscle, which is also helping. Okay. Then release your hands. Place your left foot flat onto the floor. Take your right hand onto your right knee. And then move your right knee a little bit toward the midline as you have your knee toward your chest. So you feel a little stretch or no stretch. It's just when you breathe in and out, you want to feel your abdomen expanding and contracting. On the right side, you have another valve that opens up from the small intestine toward the large intestine. And by having your knee bent like this toward your chest and breathing deeply in and out, you encourage that valve to open and close. Then release your hand from your knee. Take your right hand onto your foot and then bring your knee out to the right side. As much as you can. Maybe now, try to again keep your hip even onto the floor as your knee comes out. Concentrate trying to keep both pelvis onto the floor, both iliac, as your knee comes out. Breathe deeply in and out again. Resetting all the nerve endings within your belly, within the navel. Then release your hand from your foot and allow your right foot to come down onto the floor. Pause for a moment. Let your fascia system and your hip and your lower back, your abdomen just kind of move and rest. Yep, and then slide your leg. You can actually, what you do, you can open your knees to the side comfortably And then slide your foot straight or leg straight. There you go. So you feel a gentle rotation as you did that. So now let's go into a meditation. So adjust your body so you can relax. Allow the palm of your hand to rotate upward toward the sky. Allow your heels to be on the outer edge of the mat. Take several breaths in and out. If you want to, you also can place your hand onto your belly. That's okay. Resting your elbow onto the floor. And just breathe in and out. You can, as you inhale, you can bring your tip of your tongue towards your palate. As you exhale, release and open. Let your tongue rest. And then with every exhalation, soften your body into the floor. Soften the upper shoulder. Soften your shoulder blade. And then from there, bring the awareness to the front of your chest and soften your deltoids. Soften your upper arm on the right side and the left side. And then if you have your hands onto the belly, I invite you to sense the right rib cage and the left rib cage expanding naturally with your breath. And then explore taking a little bit deeper breath in so you can feel your belly more and more expanding. So breathing in fully and then exhaling out completely. Then as you do the deeper breathing, can you noticing a slight movement in your lower back? Micro movement again, those are not big movements, just little movements. And then just allow your breath to come to a natural rhythm. And then perhaps get a sense if you can feel your breath flowing into the right hip, into the left hip. And then if you can feel the flow of breath into your legs. If not, imagine you can feel it. And then with the next exhalation, allow your body to become a little bit more heavier so you can sink a little bit more into the floor. And then consciously with the next exhalation, soften your neck and upper shoulder muscle a little bit more with every exhalation. Allow your jaw to soften. Allow your accusable to soften, your facial muscles to soften. And then imagine the space between your right ear and your left ear. So imagine that space. And then allow yourself to sense the different air coming in. So the cold air coming into your nose, and then sensing warm air leaving your nostrils. Then bring your awareness toward your skin and get a sense of the air touching your skin, and then noticing where your shirt starts, or if you have a shirt on, of course you have a shirt on, but I mean where you can feel your bare skin, and right there where the clothes start. You might feel that around your ankle, more around in your foot. Maybe you can get more the senses of your neck and where your shirt starts, or around your arm, upper arm, where your shirt starts. So different places, different sensations. And then you come into a final, take a deeper breath in and out. And allow that now, and we're coming to the end of the practice with awareness. Just move your fingers and your toes. Then bend your knees and roll onto the right side. And then very consciously use your hand to push yourself up into a seated position. And then you may close your eyes for a moment or gaze downward, and you remember your statement of intent at the beginning. And then I invite you to contemplate on your experience during the day. And then we're going to end the session now with the namaste. So you may place your palms together in front of the heart center. Bow your head down toward your sternum. Open your eyes, getting used to open your eyes